Jesus Trilogy, Book 1, The Four Messiahs, Chapter 19. Dr. Luke, please hurry. Mary ran down the path to meet him. The sermon had gone fast. It was the 1st of August. Mary had helped Elizabeth and done some babysitting to make a little extra money. She had dodged a lot of questions. She still wasn't showing, so you could notice. Everyone except Elizabeth and Zacharias, who hadn't yet recovered his voice, still didn't know about Mary. Dr. Luke had made Elizabeth stay in bed the last 2 months. He said she was old and might lose the baby. She had started spotting soon after Mary had come from Nazareth, but the spotting ended once the doctor put her to bed. However, she still was having a hard time. Her legs were swollen to twice their normal size. It was fortunate Mary had come when she did, otherwise old Zach would have starved. It was 1 a.m. when Elizabeth let out her first scream. She had a pain in the small of her back, a pain that wouldn't let up. Zach ran for the doctor, and Mary tried to comfort her cousin by rubbing the small of Elizabeth's back. Elizabeth kept asking if it was labor. After all, she'd never had any. But of course neither had Mary. Then there came another pain and another. This must be labor, everyone agreed. Mary put a cold cloth on Elizabeth's forehead. "Do I want this?" Mary thought to herself, not realizing she had no choice. "I came as soon as I could," the doctor said. Thank goodness. He was young, handsome, 6 feet, dark hair, and just out of school. Dr. Luke was almost as tall as Joseph. Joseph! How she missed him. "Where is she?" The screaming emanating from the bedroom answered the doctor's question. Zacharias ran in, puffing hard and out of breath, and collapsed in the chair. "How is she?" he wrote on his tablet, but by this time everyone else was in the bedroom, and no one wanted him in there. "Get out of here," Luke yelled. "No non-medical professionals or personnel in here." "But I need her," Elizabeth yelled. "Okay, my nurse isn't here yet. You can be my nurse for now." Shortly afterward, 2 nurses arrived and relieved the relieved Mary. "Oh, here comes another one." Elizabeth let out a blood-curdling scream. "Another screamer," Dr. Luke sighed. He placed his hand on her very pregnant stomach and said, "Let's examine her, nurse. What was your name?" "Pamela, doctor." "Is your contraction gone now?" the nurse asked. "No, here comes another one," Elizabeth shrieked. Presently the contraction subsided. "It's gone. Let's go ahead, nurse." She motioned the other nurse to get some more towels. "Okay, doctor." These days Dr. Luke always had 2 nurses with him, at least since 2 months after his practice had begun, when a young mother-to-be had accused him of touching her inappropriately. He had 1 nurse along for that delivery, who happened to be in the other room for a short time. Dr. Luke had done nothing improper, but now he always took 2 nurses to all deliveries. He hadn't even checked the patient while the nurse was out of the room. The baby was fine, but the mother filed suit anyway. Luke's lawyer had said it was no contest, but Luke was afraid he might lose the case and settle out of court, avoiding the possibility of the attendant publicity if he lost in open court. No criminal charges were filed, thank goodness. He was just a fledgling doctor then, and he didn't need all this. He even contemplated quitting, but old Doc Martin had come down around that time to give a lecture at JU, and Dr. Luke was so impressed with what he heard that he put aside his fear and continued to practice. "Put your knees up and spread your legs, dear," Nurse Pamela said. "I can't," came the predictable response from Elizabeth. "You have to, dear. The doctor has to check you." Pamela finally got Elizabeth into position. "She's ready, doctor." Luke turned back from sorting his instruments. "Now spread your legs just a bit further. This will be a little bit uncomfortable." "It's going to hurt," Elizabeth yelled. "Easy, dear," Pamela calmed her. "Oh, here comes another one," Elizabeth cried. Dr. Luke turned away. "We'll wait until after this contraction." "I'll be dead by then. Oh, doctor, why won't this baby come?" "Easy, easy." Pamela gripped Elizabeth's hand to reassure her. Elizabeth looked up from her agony. "I know, spread 'em." "It's the only way," Pamela said. Luke washed his hands in warm water and inserted 2 digits into Elizabeth's vagina. As he did so, he noticed a drop or two of blood, and then there was a gush of milky water which soaked the bed, as well as the doctor's hand and arm. "I'll clean it, Doctor," Pamela offered. "No, let me finish my exam first." He noticed a greenish tinge to the fluid when he had pulled out his hand from the vagina the first time. He now reinserted the first 2 fingers of his left hand (he was left-handed), passing through the swollen labia as he stretched to reach the cervix. It was posterior and very difficult to reach even with his long fingers. Finally, Dr. Luke got a hold of the anterior lip and slipped his fingers into the os. Moving his fingers carefully, he could feel the smooth surface of the baby's head and judged Elizabeth to be about 4 centimeters dilated. A look of concern came over his face. This 60-year-old woman had an untested vagina, and he feared she might not dilate further and might never get this baby out. And even if she did, she would most assuredly tear, probably severely. He had thought to bring some clotting ointment. He probed a little further and felt the baby move, but he wondered about the greenish fluid. The nurse noticed the doctor's face turning a little pale. Beads of sweat were forming on his forehead. Oh, if he could just talk to old Doc Martin. Doc Martin would know what to do. "Something wrong, doctor?" He shook his head. Why do nurses always ask questions out loud in the presence of the patient, he thought. "What's the matter, Doc? Is he okay?" Elizabeth asked. He now wondered why Elizabeth called the baby a he. "Nothing's wrong. Everything will be fine." He was glaring at the nurse. "Here comes another one," Elizabeth wailed. The nurse, who had asked the wrong question, now tried to make up for her slip and grabbed Elizabeth's hand, coaching her as she breathed through another contraction. Dr. Luke went out of the room. Both Mary and Zacharias noticed the anxiety in his face. "I think she's breech." He had not felt any fontanelle or suture lines. "What's breech?" Mary asked. Zacharias knew. He had been called a breech delivery a couple of years ago. The baby had not made it. It was the saddest of funerals. He now folded his hands and began to pray, silently, of course. "The baby should come through the birth canal head first, I think. Elizabeth's baby is coming rump first." The doctor didn't bother to mention the green tinge to the fluid. It was a sign of a baby in distress, but if the baby couldn't even come through the birth canal, it wouldn't matter. Most of the time, a breech baby will deliver okay, but sometimes they get stuck. Elizabeth is, well, older, and her tissues are not very pliable. Mary sat. She, too, turned pale. "So what do we do?" "There isn't much we can do. We just have to hope Elizabeth dilates completely before she tires too much, and that her tissues will stretch enough to allow the baby to deliver." "But what if it doesn't?" she kept quizzing him. "There's a new technique named after Caesar. They cut through the abdominal wall and deliver the baby that way." "Sounds terribly painful to me," Mary shuddered. "It is, and the bleeding can be a real problem," Luke said. "Do you do that procedure?" "No, only the big medical centers such as Rome, Athens, maybe Jerusalem." "Have you ever done or seen any?" "No." "Help!" came the cry. Dr. Luke went back into the bedroom. Zacharias had written on his tablet, "We'll just have to trust in God, Mary. Dr. Luke is all we have." Luke had not mentioned the technique of conversion by external means, but in this age group he expected it to be futile. Mary did not have total confidence in Dr. Luke, as Zach seemed to. She wondered if little Jesus might be breech, and prayed not. She and Zach sat in awful silence for about 20 minutes. Dr. Luke then reappeared. "She's not dilating. Been 4 centimeters since I got here," he reported. "Mary, can you do me a favor? Run over to my office and get me something?" "Yes, it's a dilating herb. I didn't bring it, but it may help, and we need all the help we can get." He told her where to find the herb and ran back into the bedroom. Mary took off running. She had excelled in track at school. Luke's office, which was attached to his house, was about a mile away. Despite her condition, she was now 4 months along, she ran like the wind. It was 3 a.m., and she prayed no one would accost her. She used the key to open the locked cupboard across the room and found the vial marked herb OB number 4. Then she found the jar of gel to mix the two. She relocked the cupboard and ran back as fast as she could to Elizabeth's house. Oh, good, you found it, Dr. Luke said. She's dilated to 5 now, but she's definitely breech. I tried to convert her, but it didn't work. This should help. Thank you. He took the vial and the gel and went back into the bedroom. Carefully, the doctor mixed the two and applied the mixture to Elizabeth's cervix. He then sat back and waited. Nearly 2 hours passed while Dr. Luke dozed on and off. He had a full schedule beginning at 8 a.m. that morning and hoped this would not interfere. Why do babies always deliver at night? He wondered as he dozed.